Perform an oral intubation. Sorry, oral endotracheal intubation.
Okay. All right, BSI. We'll make sure I have the appropriate PPE. I'm gonna go ahead and insert an OPA. Okay. I'm gonna get my bag valve mask hooked up to high flow oxygen, 15 liters per minute. Okay. I'm gonna make sure there's a good seal. I have good chest rise. Ventilating at 10 to 12 per minute, or 1 every 5 to 6 seconds.
Okay.
Okay, I'm gonna have my partner take over doing the ventilation. I'm gonna go ahead and get set up here to do my intubation. I'm gonna have a secondary airway in case something goes wrong. I have my tube with the bougie preloaded. I have my Mac blade. Make sure the light's on, that's tied on there. That's white, so that's good. I'm going to make sure I have suction on hand if we need it. Make sure that there is a securing device in place so that once we get the tube in, that it's right there and ready to go. Before I do that, I'm going to make sure I have my partner pre-oxygenate the patient. Going to make sure that SpO2 is above 94 and that we're ready to go. Okay, I'm going to make sure lubricate the distal tip of both the backup and my tube. And I'm going to go ahead and when my partner's ready, I'm going to have him remove the bag valve mask. I'm going to remove the OPA. I'm going to have my blade set up here. Go in, make sure I'm not pressing on the teeth. Okay, pushing up. All right. Looking to see if the balloon goes past the vocal cords. Okay, not letting go of the tube. I'm gonna fill up. Okay, make sure that I remove the 10cc syringe. Okay, now that it's in place, I'm gonna remove the bougie. I've got my bag valve mask. I'm gonna make sure to look for equal chest rise. I'll have my partner hold as I'm going to listen for long sounds there. Okay, I'm gonna listen on the left. Okay, the epigastrum. Okay, and then the right. And everything sounds good there. I'm gonna make sure that my patient isn't hypoxic. And I'll go ahead and get the securing device in place. So we're gonna go around the tube here. Okay, cat on there, there we go. Okay, so it's secured. Up here. There we go. Okay, secured in place. Now listen to long sounds again, make sure that the tube didn't get displaced. I'm also marking the teeth at, I can't see it, 25 I think is what it said.
Yeah. Okay, your lung sounds are still good.
Lung sounds are good.
Yep.
Okay. All right, we're going to continue to ventilate. I'm going to remove the back valve mask for a second to add either end-tidal CO2 or oxygen or colorimetric. Making sure that everything's good there.
Okay, how would you make sure you have proper rate and volume, and what's your SpO2 and capnography targets?
So looking for a good equal bilateral chest expansion.
Okay.
I'm looking for 1 breath every 6 seconds, or 10 to 12 per minute.
Okay.
I'm looking for SpO2 above 94.
Okay.
and we're looking for our target areas 35 to 45 for end-tidal CO2.
Okay. And then how would you recognize the need to suction?
So if I need a suction, I'd hear gurgling sounds, or there'd be resistance with the bag, maybe fluid coming up the tube at that time, and yeah.
Okay, you need to suction.
Okay, all right, I'm gonna have my partner take over while I get the suction ready. Okay, I'm going to measure the catheter. We're gonna use a French catheter. I'm gonna measure from the sternal notch here, around the ear, and to the nose. Okay, and I'm gonna mark that with my finger. And when we're ready, we're gonna go ahead and remove the BVM. I'm going to insert this until I get resistance. I might have clamped that a little too tight. There's like something going on there. Yeah, it's just way too tight. That's what it is.
There we go.
Okay,
Okay, you suctioned.
all right, suctioned. No more than 15 seconds on the way out. And then I immediately ventilate again, making sure that the patient is not experiencing any hypoxia, any SpO2 lower than 94. We're looking for good end-tidal and signs of perfusion.
Okay, how would you reaffirm your tube still in place?
Okay, so I'm going to look and make sure that it's at the right depth still.
Okay.
Also going to monitor with the end-tidal CO2, and then I could also take and double check.
Awesome. Good job. Is there anything else you would like to add?